Hello and welcome to the EduTalk author series hosted by Biotone EduPartner Program, and massage industry authors. The EduTalk author series is a bonus extension to the EduTalk Tuesdays to further support virtual learning and connect you with industry authors who, through their books and textbooks, support your career success. Today's author is Kathleen Lisson, a board-certified massage therapist and certified lymphedema therapist, focused on helping clients with lymphedema and lipedema, as well as clients who've had plastic surgery and reconstructive surgery following cancer. She's presented at the American Vein and Lymphatic Society, Fat Disorder Resource Society, International Society of Lymphology, MLD UK, Society for Oncology Massage, and National Lymphedema Network conferences. She's a co-author of Standard of Care for Lipedema in the United States, published in the journal Phlebology, and grant-funded by the National Institutes of Health and National Heart, Lung, and Blood Institute. Let's listen and learn as Kathleen shares the inspiration, insights, tools, and tips from her book, Stress Reduction for Lymphedema, and she'll review her second book, Lymphedema Treatment Guide, providing keen insights for client well-being and practice success. Kathleen, thank you for joining us and reviewing your books. Would you do me a favor and hold up the covers again, because the camera seems to focus on the person speaking. So first we'll review Stress Reduction for Lymphedema, and then we'll follow that review with Lymphedema Treatment Guide. And with that, thank you for joining us again. I'll turn the screen over to you to share with us the genesis and inspiration of the book, what's inside, and how it will help one's career. So here you go, and I'll see you on the other side.
Thank you. Thank you so much. So hello, everyone. I'm so excited to share information about two of the books that I've written. These books were written for clients with lymphedema and clients with lipedema. I think they are also so valuable for the massage therapist to read if you are going to have clients with lymphedema or clients with lipedema in your practice. So let's start with my inspiration for my latest book, which is Stress Reduction for Lymphedema. So this inspiration actually started before the pandemic. I was able to visit the Institute for Applied Dermatology in Kasaragod, India. My husband is from India, so we go back to visit his family. And in the same state in India that he lives in is this wonderful facility that helps treat people with lymphedema and specifically lymphatic filariasis. So I was so blessed and lucky to be able to take the overnight train up to Kasaragod and visit the clinic and do some Indian MLD hands-on with the clients. And one of the things I was really fascinated to see was that it wasn't just MLD and bandaging, that they also had yoga, they also had meditation, drawing from things that were part of the Indian lifestyle, part of their culture, to help people as they are trying to treat their lymphedema. So fast forward to a couple of years later, in the middle of the pandemic, I was giving MLD to my clients, and I was finding over and over again that it was more than just pulling fluid from, one area of the body, the interstitium, and putting it into the lymphatic system and drawing it through the lymphatic system so it could be excreted out of the body as urine. So that definitely happens. But in my hands, in my studio, more than that was happening. And I was always interested in the fact that people were saying they hurt less. So their pain tolerance was higher. And after they had the MLD than before, especially if it was after they had plastic surgery, and they would come into me and they would say, I'm so scared. I don't even know why I'm here. I can't even touch my body part that's affected by this swelling. It's so painful. I don't know how I'm going to get through this hour of massage with you. And I was becoming more confident in saying, you know what, it's a gentle skin stretching stroke. In my experience with my clients, it's not going to hurt as much when I do it. And you're actually may feel better afterwards, and you may be able to touch your skin afterwards and feel more comfort in that than you would before the massage. And then I started, curiosity got the better of me, and I've written several books, so I know all about PubMed. So I got on PubMed and I was like, what are some of the other benefits of MLD? Let me do this deep dive into manual lymphatic drainage research. And absolutely, I found it. I found research that showed that in the researchers' experience, that MLD improves the pain tolerance, and so people can tolerate more pain, and then their threshold for pain is higher as well. So they can take more pressure before it starts to have the body interpret it as pain. So these two things were kind of in the back of my head. And then I said, you know what? If this is going on, what else is going on? What else in research is there? Is there really just the same things that we're routinely told that the average person with lymphedema knows? You know, the average person with lymphedema gets their diagnosis, goes through decongestive therapy, and then is told, you know, do MLD every day. Let's focus on the skincare, get your exercise, nutrition is important, wear the garment and do the MLD. And what if there's more to that? Because the clients that I'm seeing when they are after CDT and they don't have insurance coverage anymore, and they're coming to me for private cash pay MLD, are looking for, you know, what else can I do? What else is out there? I want to do everything I can do to help me live my best life and help me, you know, keep my lymphedema under control. What else can I do? And I looked at the research, and there's an amazing amount of research that I was just not familiar with, so much so that I said, you know what, I want to put this all in a book. I want to put it all in one resource. So it's a resource we can confidently give to our clients as therapists and say, you know what, if you're looking for more, if you're looking for breathwork practices, because we do deep breathing as part of our MLD session. And if the clients are saying, wow, you know, that is really relaxing after I do these deep breaths, you know, what else I need to, for clients with me, they would always be like, oh, yeah, you're right. I really need to do more diaphragmatic breathing. I really need to focus on that more. Like, now that I practice it here in your office, that's something I want to take forward with me as part of my self-care protocol. So what else can we share with them? Suggestions for their self-care protocol that are backed by research. And a lot of it is research on populations with lymphedema, research on populations with a cancer history, and just research on the general population to be practices that reduce our stress response, because the sympathetic nervous system innervates our lymphatic system. So our lymphatics are directly affected by how much stress we have in our body. So I share that research, and then I share practices for clients, practices like breath work, practices like mindfulness, practices that involve the body. So a lot of clients, especially if they've had a cancer history and then have lymphedema, are engaging in these mindfulness self-care practices of complementary medicine to get them through their cancer treatment. And now that they have lymphedema, they want to keep on doing these practices like acupuncture. But how can they continue doing acupuncture and still have it be safe now that they have the diagnosis of lymphedema? So there's research on that, on specific points and specific protocols that are helpful for people with lymphedema as far as acupuncture. And so I shared that in the book. And then also movement practices. So people want to go to the gym. They know that exercise is important. They know that water exercise is recommended. They may have a yoga practice that they started that really helped them. These mind-body practices really help them to be to reduce stress while they're in their cancer treatment. And if they have a diagnosis of lymphedema, how can they continue practicing yoga in a way that's safe for them with their lymphedema diagnosis? So there's research on that as well, and there are specific protocols. And so I looked at some of, again, going back to the beginning, when I was in the IAD in India, what kind of yoga protocol did they do? I looked at that research. There's research from Europe. There's research from America on what are some suggested protocols for yoga if someone has a lymphedema diagnosis, both upper limb and lower limb. And then also the senses. And I love this chapter because I want to give people permission if they feel like, sometimes these things are nice, but are they actually helping me? So I want to draw the attention to how we can use our senses, and even like our sense of humor, like laughter, can help improve our body's ability to be healthy and reduce our stress levels. And that's some very interesting research in the use of laughter when people are going through cancer treatment. So I included that research in the book. And then lastly, I focused on community. So there's a lot of community resources, and having a community that of people who are going through a similar experience is very important for people who have a lymphedema diagnosis. So I shared resources from Learn, resources from Lymphy Strong, which is a great Facebook group that it supports people who have lymphedema. And also there's another great resource out there if you want to Google it. It's Lymphopress. They have a monthly roundtable support group online for people with lymphedema. So you can direct your clients to that support group. And just giving them resources, just showing them the importance of having that kind of support in their life and why support is important for people with a lymphedema diagnosis. So I wanted to put all that together in one resource. So not only can we understand more fully what our clients are going through, but they can understand the wide variety of free and very inexpensive resources there are out there as far as their self-care practices for getting the best result from their self-care to help support them in their lymphedema management throughout their life. And rereading the book, I found something really interesting, and that was chapter 1 of the book, when I was rereading it a couple weeks ago, is a really great resource for family and friends. Because maybe if you don't know that much about lymphedema, and there's not really as much lymphedema awareness out there as there is for other diseases, you might think, it's just a plumbing problem. It's just swelling in the arm or swelling in the leg that happens after you remove a lymph node or have radiation or have chemotherapy for cancer treatment. And all it is swelling. So if you reduce the swelling, then your lymphedema is gone and you must be all right. But it's far more complex, just like the human body is far more complex. There's nothing as simple as just a plumbing problem. So chapter 1 is a really great resource, not only for the person who has a new lymphedema diagnosis to understand the different interactions lymphedema has with the body, but especially for the loved one, the family, the friend who's supporting someone who has lymphedema, for them to more fully understand what's going on, because there's not only a physical aspect, and it's not only just the lymphatic system, there's a psychosocial aspect, and the way the lymphatic system interacts with all the other systems in the body. So that chapter 1 is just a really great chapter to share and to read and to have the family read, because lymphedema isn't just a disease or a side effect of cancer treatment that affects just the person who has it. It affects the whole family. It affects the whole friends of the person who has the lymphedema diagnosis. So I wanted to make this book also a book that would be something that the family structure can use as a tool to interact with the person that has the lymphedema diagnosis, and participate as a group, as a family, in their self-care. So particularly with the breath work activities, the movement activities, is something that you can share with other family members. If you have a yoga protocol, you can do yoga with another family member. So if you're a family member, a loved one that has, someone who has lymphedema in your life, you can say, hey, let's do yoga together. Let's do this breathwork practice together. I saw this book and I'm reading it, and it's sharing some of these breathwork practices. Let's do this 5-5 breathing together and see if that it's, again, that drawing in this community aspect. As a community, we can support people with lymphedema. So with all that talking, I want to start presenting one very simple practice from the book. And I talked about it a little bit right before. It's called 5-5 breathing. So it's an inhale of 5 and an exhale of 5. So I'm going to guide us in a short breathing practice. And so take in right now just an impression of how you are feeling right now as you're watching this video, your current stress level, just your moods and emotions right now. And then we'll check in after just a short 1-minute practice of this breathing together. So I'll invite you to take a position that is respectful yet comfortable. So you can sit a little straighter if that helps you. And then we're just going to inhale for a count of 5. So inhale. And exhale for 5. Inhale. And exhale. Inhale. And exhale. Inhale. And exhale. And last one, inhale. And last exhale. Okay, so we can let that practice go. I'm not sure how that felt to you, but to me, I feel a lot calmer and more grounded now, just with that 1 minute of breathing. And I notice even now I was talking so fast because I'm excited to try to get this information to you and get you excited about this, because this is such an underserved population that it is our calling to help. But just this short practice has kind of put me in a much more peaceful state. And that is really the message that I want to get across with this book, is that there are so many practices in this book that can help get our clients. Look, I'm a little of a clump right now. There are so many practices in this book that can help our clients achieve that more peaceful state, that more comfortable state of living. That I just wanted to put them together, and I wanted to get them out to everybody, and I wanted to share them with you, so that you can potentially share them with your clients, because you are seeing them. Hopefully, if you're seeing people with lymphedema, you're seeing them on a regular basis for manual lymphatic drainage. And this book would be a great opportunity to help them put more tools in their toolbox to help them more effectively manage their lymphedema throughout the rest of their life. So that is my review and my kind of overview of the inspiration for the stress reduction for lymphedema, the content inside it. We kind of did a brief look at what the content is inside it, and also how this can help your career as a massage therapist. Definitely reading the chapter 1, more understanding the issues that people with lymphedema are going through, because it's a lot more than just a plumbing problem. There's a lot of physicians that don't know what this is, so they may get a lack of full treatment from their medical providers. The medical providers may not know all this information. There's difficulty in obtaining resources, in obtaining insurance coverage, in being able to go to the store and buy a pair of pants or a pair of shoes or a shirt that fits them. There's so many issues going on with lymphedema that we can help improve our empathy towards this client by truly understanding the spectrum that's shown to us in research in these published articles that I cite, of what the impact of lymphedema is in our client's life. So that is my review of the stress reduction for lymphedema. So now I'd like to turn to Lipedema treatment guide. And this is a really great book for massage therapists that are going to help people with lipedema. And it's a really great partner to the stress reduction for lymphedema book, because in the later stages of lipedema, the person may also have lymphedema as well. So this is a great book. It's focused for the client, but you, as the massage therapist, can grab a lot of the resources, more fully understand why clients have tried a lot of different interesting treatments that may come on their health history form, and understand what the lived experience a little more fully is of having lipedema. So I wrote this book before the pandemic. This book has been out for a few years, and I think it's a great overall resource because lipedema research has exploded over the past 5 years. It's been so amazing to see how much research and how much interest there is in this disease, because I wrote this book in response to the fact that there was nothing out there on the internet that I could give to my client the first time I had a client that came to me with lipedema. So this was a client that was referred to me from Dr. Amron, who's a physician. He's a surgeon in Beverly Hills, and he does liposuction for people who have lipedema. Liposuction is a surgical treatment for people who have lipedema. And he sent a client to, or the client found me because they wanted to go vacation right after their surgery in San Diego, and they wanted me to come and give them manual lymphatic drainage. And I always, ever since I was in massage school, what we did in our massage school student clinic is we would give the client the massage, and then afterwards we would give them something like homework, like, oh, here's a stretch you can do, here's some Epsom salts, here's a meditation you can do. It was just something to give them for their self-care, so they could have the effects of the massage, go into their future life. And so this is a practice that I brought with me to my practice now that I'm in private practice, which is why you see I've written so many books, because I want to give this resource to the client as they leave, to give them more information, to give them more tools and resources. And I wanted to do that. So I thought, hey, I'm having this client, I'm going to see her for MLD in a few days, and she has lipedema. So I'm just going to go to Google real quick and print off some stuff, really quick. I learned about lipedema briefly in my training as a lymphedema therapist. So I'm sure there's going to be stuff out there, and I'll print it out to her, and then, we'll get her the resources and we'll get her going on her best foot for her recovery. And guess what I found on the internet for resources for people with lipedema? Zero. Big, huge goose egg, because there was nothing out there at that time. So I said, you know what, this is my call to action. A lot of things that have happened in my career have happened because of one client, and I let one client's experience change me and focus my research and my interest in a different direction. And this did it with this client. And I said, you know what, there's nothing out there that's publicly available. People with lipedema are told by so many others that they don't even have a disease, that this is an internet disease, that it's not real, that they just have, that they just need to go home and try to lose weight. So I wanted to put together a resource and gather all the research that I could find that was published at that time, and put together something as close to soup and to nuts as possible, but just giving a lot of like a paragraph or two on a lot of different options, and then links to the research in the back of the book that would give them like research and the website, so they could go and read these studies, so they can really educate themselves and be able to make a more intelligent choice for what their self-care was. So that's why I started with this book. So the focus for this book, I wanted to be very official. So I wanted to look at what are the treatment goals for lipedema. So I put in the book, what are the actual treatment goals? And this is very valuable for someone who is a massage therapist who is helping someone with MLD, who is helping a client with lipedema with MLD, because we have to focus on what are we really doing here. Tell me, as the person who has lived experience with lipedema, what is the difficulty with your lipedema, and let's see what types of tools that I have as a massage therapist that we can get that can potentially help you achieve your treatment goals. Because we're not going to just do MLD and come out of the massage session with a set of legs that don't look like you have lipedema, because MLD is not the cure to lipedema, and liposuction is not the cure to lipedema. You will still have lipedema, but I want to see what I can do as a massage therapist to get you to the best life that you can live. And if we can look at what the treatment goals possibly are, we can see what tools we have in our massage treatment offices to help you reach those goals. So one of the big goals is pain and inflammation. So I wanted to go to page 69 of the book. And I cover treatments that are both kind of accepted and a little more controversial, including manual lymphatic drainage, IASTM, instrument-assisted soft tissue mobilization, and other pressure-based treatments like Tuina, compression garments, cupping, athletic taping, deep oscillation, cavitation and shockwave therapy. And we've heard even more of this cavitation and shockwave therapy in recent research by Karen Ashforth. Cyclic variations in adaptive conditioning, or CVAC, vagus nerve stimulation, biofeedback, meditation for intense pain, Epsom salts bath, hydrotherapy, supplements, natural pain and swelling remedies. So not all of these are within our scope of practice as a massage therapist, but I wanted to give resources that the client could look up the research on it, and then have that intelligent conversation with their healthcare provider. I mean, I wanted to give massage therapists the information they need to do their research. So when they see that this is something that the client with lipedema is currently doing, they can more fully understand why they're doing it and look at the research behind why this might be effective for them. Also, a section on mobility and physical activity, because mobility and physical activity is different because of some of the things that happen because of lipedema affecting the body. You need to be more careful with certain types of physical activity. So I share some information there, and I share some resources that you as a massage therapist can share with the personal trainer if they have a personal trainer that's helping them with their physical activity and exercise. And then also, how do they negotiate airplane travel? If they're at a later stage of lipedema, how can they use adaptive tools to help them get in and out of the car? Some information about their psychosocial health. Again, this is not within our scope of practice as a massage therapist, but it's important to understand the psychosocial aspect of lipedema if we're going to treat the whole client and not just the body part with one particular type of massage called MLD. And then also some meditation resources. So I wanted to put this all in a resource because I wanted to write the book that I wish I would have been able to give to my client, that first client that came to me. I wanted to write that book and say, you know, you've had the surgery. This is an amazing part of your treatment and a huge part of your treatment for your individual lipedema. So, but you're still going to have this disease for the rest of your life. So let's see what other things that we can, you know, some of us, for some of them, we can partner together. And for some of them, you can partner with other healthcare experts to help you give the best self-care for your lipedema, for your self-care protocol that you do every day to have the best life that you can with this chronic, often progressive disease. So that is my review of the lipedema treatment guide, including my inspiration. We looked at a little bit of the content, especially the content about the pain and inflammation, many of which those tools we have in our studios as massage therapists. And then kind of the idea on how I recommend this, that it can help you in your career to better understand this client, the client that has lipedema. And then if this is a resource that you wanted to recommend to them, that they can more fully have just many of the tools at their disposal and some ideas that they can take to that healthcare practitioner, whether it's in the later stages, it may be a lymphedema therapist if they have a diagnosis of lipedema and lymphedema, or it may be a vein specialist if they want that diagnosis, that initial diagnosis of lipedema, just to give them all the tools that I had and that I saw in the research at the point that I wrote this book. So that is my review of the lipedema treatment guide. Thank you so much.
Well, thank you so much, Kathleen. And really, I mean, your passion comes through. The key points to me: building your support system, being educated, and also, just went right out of my head. So support system, education, and will it ever come back? Because that thought just went right out the door. But really, you have put together two great books, not only for the professional, but also for the client. And I would like to ask, number one, how do people go about purchasing these books? Where can they find them?
Yes, they're both on Amazon, and they're both in paperback and Kindle. So whatever is easier for the person who wants to read it. I know some people really like Kindle, so I put them in both paperback and Kindle on Amazon.
Great. And I would like to mention to our audience, Kathleen has previously reviewed her book, Plastic Surgery Handbook, that can be found on biotone.com under the EduTalk tab in the author series. Additionally, Kathleen has presented three at least, EduTalks related to plastic surgery, and you just most recently did the stress reduction for lymphedema, and
Yes.
that was excellent. So understanding more about the book and the inspiration and really feeling your passion about it, I do think this could definitely help the professional massage therapist, and really build a partnership. I think that's what I was searching for earlier. Building a partnership with your client that here are goals, here are things we can do. Your other doctors can be tied into this, and it takes a village, it sounds like.
Yeah, and I really love that you picked up on the theme of partnership, because with this last book, Stress Reduction for Lymphedema, I had someone who's a colleague of mine really come up with a great idea, and that is they sent this book to their local naturopaths, to the people that they wanted to refer clients to them, the lymphedema clients that those doctors, that those surgeons, that the naturopaths had, and they were trying to introduce their practice for referrals. And they said, hey, this is the kind of practice I run. I give this book to each one of your clients. Let me give one for your office too. And then they put their sticker. So they got a sticker that was their business card, and they put the sticker that was their business card right here. So this book is now in that naturopath's library, in that doctor's library in the office. And every time that doctor sees someone with lymphedema, they're going to be like, oh, I know this lady that can help you. And they put their sticker right inside of the book. So if you were looking at like plastic surgeons, if you have a plastic surgeon in your area that helps with liposuction for lipedema, and you want to take those post-op cases, maybe you get a copy of the lipedema treatment guide, and you put your business card in there as a sticker, and then give it to that surgeon. And there's a really great resource called the Lipedema Provider Directory, that's online. If you type in lipedema provider directory and Google it, you can see all the lists of the lipedema providers, and those can be referral sources for you if you have a practice that has MLD, and you can demonstrate how you have understanding of this client, and you really want to help them as part of the care team to take care of those clients. And then you get your business card right there into the practice in a way that they can understand that you care about these clients so deeply.
And that's a great marketing opportunity.
Yeah.
It really is. And that's, again, building your own personal professional network
Yes.
To support clients with these diseases.
Yeah.
So thank you so much for reviewing that. Please do visit biotone.com under the EduTalk tab to review the live EduTalks that Kathleen has presented over the past 3 years, and
Yep.
also the review of her plastic surgery handbook. Thank you so much. I learned quite a bit through this, and I could keep asking questions, but we'll leave it up to the audience to have their own questions and seek out the solutions through your books. Thank you so much, Kathleen. And quickly again, if people want to get in touch with you, what is the best way for them to get in touch with you, or what is your website? And you also mentioned support groups. Do you list any support groups on your website, or would that all be through the books?
So you can find the support groups in the book, because there's different support groups for each area. The FDRS is a really great resource, and they have a YouTube channel. They have a conference every year. So if you look up Fat Disorders Resource Society, you can find them, and they're a really great resource, especially as a clinician, to understand more about lipedema and other fat disorders like Derkham's, like Madelung's. There's a lot of rare diseases that involve the adipose tissue. And they have FDRS and different organizations, foundations there may have more resources and handouts that you can give to clients. And for the stress reduction for lymphedema, you can look at my website, KathleenHelenLisson.com. And then you can look, and right here is my name on my Instagram is @KathleenLisson, or my other Instagram specifically for lymphedema content is @stress reduction for lymphedema on Instagram. So I'm trying to be everywhere all at once.
Well, good for you. You've got incredible knowledge to share. And thank you again for presenting your books in review for the author series.
Yes.
Thank you so much, and take care.
Thank you.